Hello students, this is part 2, and in this part we're going to go in a little more detail about the lymphatic system. So organs that we also find in the lymphatic system include the spleen, the tonsils, and the thymus. Remember that the spleen is in your upper left quadrant. Normally it's not palpable unless you have some type of an infection which is creating it to be palpable. So diseases like mono, lymphoma, leukemia, cancers, different things like that can cause inflammation in the spleen. The function of the spleen, it destroys old red blood cells. So we know that we're always constantly producing new red blood cells, and the function, one of the functions of the spleen is to destroy the old ones. Once they've matured or past maturity level, they need to be destroyed, and the spleen helps with that. So when we I'll finish the rest of this up quick, and then I'll just tell you one little tidbit as well. Of course, it needs to produce antibodies. It's part of the immune system. So whenever we have exposure to infections, it's going to help us to fight off those infections. So antibodies, remember, are those things that we build up to help provide immunity to certain diseases. So in other words, you have received immunizations, maybe your measles, mumps, rubella, maybe your varicella, tetanus. Every time you get a shot like that, or even just your recent flu vaccine, when you get those shots, the idea is that your body is going to produce antibodies in response to exposure to that vaccine. And the more antibodies that you're able to build up, the more immunity you will have against those certain diseases. It also stores the red blood cells, so not only does it destroy the old ones, but it also will store new ones. And it'll filter any microorganisms that you may have in your blood. Remember, we don't want to have microorganisms in our blood, so the spleen helps to filter those out. Now, what I was going to talk about before is that this kind of helps when you think about blood being stored in the spleen. It helps you to understand just how much blood is in this particular organ. When someone has mono, they're often told that they need to avoid contact sports. So if any of you have had mono before, you've probably been told that you need to take it easy for several weeks, usually anywhere from 2 to 4 weeks. If you're a wrestler, you can't wrestle. If you play basketball, you can't play basketball, and so on and so forth. Even gym class or physical education class can cause problems. Even going out on the playground and playing with friends can cause problems. And the reason for this is because, say that you got injured or you got hit in some place close to your spleen. When you think about that, the fact that the spleen is full of blood, you can imagine that if you damage that spleen and it's already inflamed, and now you've created a trauma to it, you could cause it to rupture, and the person can have, it can very quickly have abdominal internal bleeding. So that's why they tell you to stay away from contact sports. I want to share something really quick with you regarding that. I was the wrestling cheerleader coach. So it was, what I found interesting once was that my cheerleader was told when she had mono that she wasn't allowed to cheer. And we don't stunt when you're wrestling cheerleaders. I know some do, but we didn't. We just sat by the mats and did the cheering. But it wasn't the cheerleading that they were worried about. It was the fact that sometimes when the guys are wrestling on the mat, they go off into the people that are sitting on the side, so they could potentially land on her and cause her spleen to rupture. So I just thought that was kind of cool that they thought about that as well. The other organs, again, are your tonsils. We have 3 different types of tonsils. We have your palatine tonsils, your adenoids, and your lingual tonsils. And you can read more about all of those in the book. the adenoid tonsils are often called your pharyngeal tonsils, or excuse me, your adenoids. So we talk about having your tonsils and adenoids out. The adenoids are also known as the pharyngeal tonsils. And then we have the thymus gland, and that is in the superior mediastinum. So remember that mediastinum is in that central thoracic cavity area. It houses the heart and the great vessels, and part of the bronchus, the trachea. So the thymus gland is behind the sternum, but it's in front of the aorta. So, and it's in the superior aspect, so it's in the upper part of that mediastinum. So this picture is from page 513 in your book, and you can see the pharyngeal tonsils or the adenoids, the palatine and the lingual there at the top. You can see that we also have lymph nodes in the axillary region and also in your neck, and you already are aware of the neck ones because those are some of them that you're already palpating. To me, those look like the superficial cervical and the deep cervical chains. And then you see where your spleen is as well. Also notice that we have lymph tissue in the intestines. Those are called Peyer's patches, and you probably learned about those in A&P class, but they also help with the immune system by specifically controlling inflammation and infection in the intestines themselves. All right, so a few things regarding the lymph system as it relates to developmental aspects. When we talk about infants and children, remember the lymph system acts the same for both. It's not different as far as functions go when we go from infants and children to adults. They have the same functions. It's interesting because typically we hear that when infants are born, things aren't well developed, but the lymph system is. It's very well developed. It grows rapidly until age 10 or 11 to adapt to the changing environment for the child. Just note, though, as well, when I talk about it being well developed at birth, these are for healthy babies. Remember that some babies aren't born as healthy as others, so their lymph system may not be as developed as others. In children, one thing that you might notice if you ever get to do an examination or an assessment of a child is that their lymph nodes tend to be larger on a normal basis. So they may be completely healthy, but they still have enlarged lymph nodes. And just know that this is a normal variant that we find in children. When we say that they're enlarged, we consider that they have something called hyperplasia. This is just excessive tissue growth. Now, hyperplasia can be very abnormal in adults for certain things, but in children, when it comes to the lymph nodes, this is something that we tend to expect. Doesn't mean that every time we feel an enlarged lymph node, it's normal. I'm not saying that, but just know that they can be enlarged and not have any actual disease processes going on. Developmentally, we talk about the aging adult as well. A couple of things that we see happen within both the lymph system and the vascular system is that, first off, we have something called arteriosclerosis in the peripheral vascular system. So arterial meaning arteries, of course. Sclerosis, as we talked about in class before, specifically we talked about otosclerosis, so hardening of the areas of the ear. We have arteriosclerosis, so it's hardening of the arteries. As we get older, the vessels get more rigid, and that can be a normal variant. Of course, it doesn't happen to everyone, but it is one of those aging considerations that may not mean anything specific or any particular disease process going on. But if we think about how the vessels need to contract and recoil with each of the contractions of the heart, if they're harder, they're not going to work as well if because they're not able to have that contraction. They're not able to fill and so expand and dilate like we would expect them to. So that can eventually lead to some problems with some adults. Also, we lose lymphatic tissue as we get older. So considering that part of this are lymph nodes, we will have fewer lymph nodes. And remember, lymph nodes are some of our soldiers that go off and fight certain infections and inflammations. So if we have less of them, you can see how older adults have a greater chance of getting infections just for that particular reason. You can also think about it as when you're doing your, especially like your head and neck assessment, or when you're doing your assessment of your lymph nodes, you know, you may think, well, the person must be pretty healthy because I'm not palpating any lymph nodes, but it could just be because of this problem with aging. Culture and genetics, PAD we already talked about is peripheral arterial disease. Just know that it can have a genetic link, so if someone in your family has it, you may carry the gene and also have peripheral arterial disease. So these genes interact with each other and then with the environment around the person as well. Remember that smoking is one of the strongest risk factors for PAD. This adds to the arterial sclerosis, it adds to the elasticity and the health of the artery. So encouraging our patients to quit smoking, especially if we know that they have peripheral arterial disease, is very, very strongly suggested. We need to advocate for them to quit smoking. Black people often have PAD more often, and they have the highest amount of risk factors. An ABI can screen for PAD. This is an ankle brachial index, and basically I do these as part of my wound care practice. What we can do is we'll do blood pressures on the arms and blood pressures on the lower legs, and then it's a math calculation. And usually the higher the number, the less likely they are to have PAD, but if we get into too high of a number, it can mean that they do have a problem and it's a false negative. So we may think that the higher the number, the better, but if their arteries are really hard, we can get that that high number because it's not reading it appropriately. But an ABI is pretty cool, and hopefully sometime in lab I'll be able to show you what that's about. Pretibial edema and pitting edema, this is where we look to see how much edema the person is having. So you're going to firmly depress the skin over the tibia, so basically over the lower leg, and again over that medial malleolus, so right over the bone for 5 seconds and then release. There should be no indentations left. However, sometimes we do see indentations, and if you do, we need to be able to grade this. This is the scale that we use. We have mild, moderate, deep pitting, and very deep pitting. We used to measure it by time. They don't typically use that anymore. It's measured by millimeters. So looking at your little measuring tools in lab, seeing 4 millimeters, that would be 4+. So just know that others still use a time, and when we did time, we would press down on the limb and let go, and we'd count how many seconds it took for that indentation to refill. So if it was 2 seconds, it would be 2+. If it was 3 seconds, it would be 3+. That's probably the easiest way to do it, but some places are saying that it's not very accurate anymore. And they don't use that scale, however, some do. So just know that you will have to check with the facility where you work. And this is a good picture of pitting edema. And probably if we measured that, that would probably be a good 3+ or 4+. Okay, so this ends the slideshow. And you can go ahead and read more about all of this. Remember to prepare for lab, read through that objective findings section as well, because we will be discussing this in lab. All right, have a good afternoon, and I will see you in class.